Hello and good evening. I'm Melisa Idris.
And I'm Sharaad Kuttan.
Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. Earlier today, two United Nations agencies, UNFPA and UNICEF, released the fourth and final phase of a year-long study on the impact of COVID-19 and its subsequent lockdowns on the women and children of low-income urban families. Now, the 500 low-income households surveyed currently live in 16 of KL's public housing estates, or PPR flats. That's the Program Perumahan Rakyat. Now, joining us on the show tonight to share more about the final installment of the Families on the Edge report, we have Stephen Barrett. He's the Chief of Social Policy at UNICEF Malaysia. Good evening, Stephen. Thank you for joining us on the show. Now, we've spoken previously on this show during different phases of the study. Now, given that this report is in its final iteration, final of the series, and it covers a period that is exactly a year after the first movement control order came into force, I'm wondering if we could look at some of the major findings in this fourth part. What was in this fourth part, Stephen, that was different from what was already noted before?
Thank you, Melissa. So let me start off with the good news. Back in February and early March, we started to see sort of continuation of the process of recovery for many of these families. Incomes were around, median incomes were around 95% of the pre-crisis level, which is very, very encouraging. And we've seen some of that sort of economic impact track into other measures of well-being. So sort of these stresses the family finances were under, the ability to meet basic needs, even mental well-being showed some improvements. But still, unemployment amongst household heads was 2.5 times higher than pre-crisis, and even higher than that among female-headed households and households headed by people with disabilities. There's the good news to a certain extent, you know. Beyond that, we started to see some new indicators, get new insights into the impacts on children's education. So you might remember at the start of the study, we saw issues of limited access to appropriate devices, limiting children's access to education. And that fact is still there. But we started to see other constraints as well. So things like child motivation to learn, and also the ability of parents to supervise home-based learning, particularly parents that have gone back into work as the economy has opened up in recent months.
Stephen,
I think the other thing that we saw...
Sorry to interrupt you, but and it's good to see that there's some progress, but then we just had the announcement of a rather extended MCO. Likely businesses will either shutter or, have to perhaps constrain themselves in terms of expansion. I mean, do you see this as being a major setback, especially as your report notes that even when things got better in terms of the business climate, employment remained a problem for the urban poor?
Absolutely. So, of course, it's a double-edged sword. We saw families get so close to recovery, back in February, March, and now MCO3 hits. That really does bring into question whether those gains will be reversed. MCO 3.0 is different to earlier MCOs, so there's more economic activity that's allowed. But as I've said, low-income households are the first to be affected, and they're the most affected in these situations. And of course, we've got school closures at the same time as businesses being open. So those families that are going to would like to be able to go to work, they now have children to care for at home. So that's also going to you've got a double-edged sword there. We are concerned that MCO 3.0 will see a reversal of some of those impacts. And what we're really seeing here now, over a year into this crisis, is what we're characterising as a real-life game of snakes and ladders. Families are taking 2 steps forward and 1 step back, and this is emotionally exhausting for many of these families. And this is why we think we need to be thinking about longer-term guarantees.
Stephen, one of the findings that really struck me the most was the report noted that more than half of households were unable to meet essential expenses. So 60% of the respondents not able to purchase enough food. In fact, 1 in 4 of the people that you spoke to in the low-income households reported having to reduce their food intake. Now, this is startling to me, a year after the first MCO, and I'm wondering if things will get worse. How should government respond to this if they haven't already?
Yeah, so you're quite right. We've seen effects on families' diet throughout the crisis, and at the lower ends of the income scale, even small reductions of household income have big impacts in terms of the choices families need to make. I think in terms of the longer term supports, the government did make commitments in the 2021 budget to extend social welfare support for lower income families to reach all households living in poverty with those core social protection programs. I think we still need to see full implementation of that commitment. I think we also need to look at, with schools closed, there are children who were eligible for free school meals when they're in school. What provisions being put in place now that they're at home? I think that we need to be looking at mechanisms to provide that additional support now, even when schools are closed. I say beyond that, there is a need to, as we said in the past, end this sort of uncertainty for families. I think the uncertainty is as difficult for families to deal with as the loss of income itself. So ending that anguish and the anxiety for families through provision of extending the social protection guarantee to families is critical at this time.
Stephen, to what extent are these families essentially part of the informal economy? Their parents, working either in roadside stalls or in businesses like that, which are actually almost the first to be targeted in these lockdowns, and not so much the factory workers, perhaps that continue because government has prioritized them. Do you have a sense of what part of the economy these people are plugged into?
So there is a very sizable self-employed and informal sector component. I think around 15% of household heads in the study were in the informal sector. But that's not all of them. And many of them are in the formal sector. But they're in low-wage jobs and jobs where that ongoing employment is not guaranteed, and where hours can be cut and wages as a result can be cut. So it's certainly the households and workers in the informal economy are first to be hit, but it's not only limited to them.
The other thing that I thought was quite interesting from the report was, and also in the previous reports, but this one also flags the mental health concerns, and particularly, mental well-being is so easily dismissed, particularly if you're worrying about putting food on the table. Can we think about how we need to address this, the long-term impact of this, but especially when mental health support systems in the country are underdeveloped? What does the government need to do to support and address this?
So firstly, you're right, and mental health really did stand out in this report. 1 in 5 respondents reporting they were depressed, higher amongst female-headed households. And it's the financial insecurity and the risk that families perceive of being able to provide a decent future for their children, which is what they're reporting is driving the anxiety that they face. In terms of what can be done, as I've said, financial security underpins mental health security, and this is being shown in multiple contexts. So, as I said, we need to end the insecurity for these families, this ongoing game of snakes and ladders that they're stuck in. Beyond that, I think we can do a couple of things. Number one, within the education system, think about mental health of children. I think we can strengthen mental health services in school, and that has been started. There are initiatives we've heard about of training mental health specialists in schools. I think there's an issue of scale there, and there's an issue of broader capacity within the education system. I think the other thing we can think about doing is strengthening parenting interventions. 6 out of 10 of the parents reported that they needed parenting advice to support their children to get through the challenges they're experiencing. We're working with Ministry of Women and LPPKN to strengthen digital parenting advice services for low-income families. And these have a very strong pedigree and international evidence base on them. And so we think that these are cost-effective interventions that could be done relatively quickly to help mitigate some of the
Right. Stephen, just one last very quick question for you. People are very concerned about the health system being under tremendous strain. Is our social welfare system equally under strain? Is it something that we're not looking at?
Absolutely. I mean, if we think about the things that had to be done when COVID struck, the BPN, for example, that had to be done because the mainstream social welfare system wasn't available to fill the gap. And Malaysia's been struggling with this for a very long time. And COVID needs to be the opportunity, the moment when we break the mold on this and we reimagine it. And other countries around the world are taking those steps. Most recently, the US introduced a child tax credit as part of its stimulus package for nearly all children in the country to provide that guarantee to all children of that minimum standard of living and ensure their participation in the recovery of the country. And I think those are the sorts of bold measures that countries like Malaysia should be considering.
Stephen, thank you so much for joining us on the show tonight. Appreciate your time. Thank you. We're going to take a quick break here on Consider This, but more on this topic in just a couple of minutes, so stay tuned.
Induknya adalah Melayu.
Balik kepada Islam. Orang yang membuat polisi.
Kalau itu yang dikehendaki, fine. Mungkin kita berbeza pandangan.
Tapi kita mempunyai kuasa yang boleh menentukan budaya di masa hadapan.
Polisi yang mesra wanita sudah tentu dia akan datang daripada pemimpin wanita.
Perang COVID-19 masih belum berakhir. Dalam kita berusaha memutuskan rantaian wabak ini, kita jangan terpedaya dengan virus maklumat palsu. Simak fakta melalui www.astroawani.com atau aplikasi Astro Awani. Teruskan berdisiplin, ratakan lengkungan pandemik ini.
The third wave of COVID-19 has taken us by storm. There's no room to take anything lightly. Everyone must follow all the steps to stop the spread of COVID-19. Social distancing, face masks, follow these steps, this SOP with the utmost discipline. Together, we can flatten the curve.
Bila sentuh soal berita, tiada masa untuk tunggu. Kepada anda kami bawakan fakta, susulan dan kupasan yang terkini. Tiada drama dan tiada pengulangan. Usah tunggu lama-lama. Awani 745 lebih awal dari biasa.
Kini berwajah baru.
Ini pula susulan nahas pesawat Back Air di Kazakhstan. Pesawat berkenaan dilaporkan tergelincir 2 kali.
Notifikasi berita terkini dan navigasi mudah. Podcast dikemas kini dengan berita dan program.
Rebirth, Reformasi, Resistance and Hope. Hi, thank you so much for staying with Sharaad and I on Consider This. If you've just joined us, though, we were discussing the report by 2 United Nations agencies warning that Klang Valley's poorest families continue to struggle a year after the first MCO, leaving some households unable to buy necessities and having to reduce their food intake. Nurainie Haziqah Shafii is the founder of the non-profit organization Happy Bank, which works with communities in need. Aini is also the chief of Wanita Muda Negara. Aini, good evening. Thank you for joining us on the show tonight. Aini, I understand that Happy Bank has been helping individuals and households directly, that you continue to receive calls and messages from people who are in desperate circumstances, who need immediate help. And I'm wondering whether you can talk to us about your experience working, particularly with low-income households in PPRs around KL and Selangor in the past year or so.
So thank you very much, Melissa. If I may share quickly on how we started. We started about like 7 years ago. So things were going smooth for the past 7 years. And in fact, when we started to help those who are in need of help a year ago, and we started to realize that, you know, things were getting harder for people. And a lot of people got retrenched during the first MCO. And what is much more surprising is that things are not getting better even after a year. We've seen like a lot more retrenchments, a lot more families who are indeed needing help. We actually get a lot of calls from our reps, from a lot of PPRs, especially in the Klang Valley, that are even in the reports that were written. And it's shocking that the numbers are increasing. So I think things are actually getting harder out there.
Aini, you know, I know at least one government minister who's lost tremendous amount of weight, apparently in solidarity with the poor. But apart from that instance, is government listening to what's happening on the ground? I mean, you say you're shocked, but is government insulated from these realities? And are they shocked and doing something about it?
I have no idea because I don't sit in there, but I think what I can say is from the circumstances and situations that I see on the ground, I am very shocked that the government is not doing as much as they could with the power that they have. And honestly speaking, I think there is much more things to do because, you know, people are start talking about you know, how to continue livelihoods every single day. We're no longer talking just about, you know, employment. Of course, we're talking about those important policies, those important points. But most of these people in actually PPR, through my experience speaking to them, are actually talking about day-to-day lives. So, you know, you talk about like what to eat tomorrow. You talk about like how their children are getting access or not towards the school or the education. So that is actually one of like two most important things that a lot of like things, you know, talked about between me and our team with those who are staying in PPR especially. So I think the government is, whether the government is listening or not, is something very subjective for me to answer. But I think from what we have seen right now, they have not done enough.
Okay, can I ask you, Aini, in the conversations that you have with you know, households that live in PPR areas, one of the things that was flagged in the report of the Families on the Edge report was about mental health. Mental health continues to be a concern, particularly mental ill health among female households, female heads of households. And I'm wondering whether they've spoken to you and shared some of their stories and their anxieties and the concerns that they're having.
You see, I saw in the report as well that there is quite a balance between like, you know, male and female leaders of our household. And imagine like, you know, getting to speak to all these female leaders in the household, especially when they are pretty much affected by all this whole idea of how this pandemic is working. You see, like a lot of them are not just affected by the fact that they got retrenched or probably salary got cut, but most importantly, how sometimes female in the household get domestic abuse, and that is like one of like the most cases that actually got just recently or even like this past year. So that means female, especially female and children, are those two vulnerable groups that are actually prone to domestic abuses or domestic violence during this pandemic, during this MCO especially. So it is very important to actually say that, you know, if we don't address the issue of how mental health is working, especially with like the community, then we cannot address a lot of issues as well.
I know that during this Ramadan month, there's been a lot of outpouring of charity. Corporates love to give food to, other corporates, and, we in the media actually benefit from, this generosity. Is this generosity extended to the working class poor of the country? And, do you see other sectors of society stepping up where government might, in fact, not be acting fast enough?
There's actually two things that I think most importantly to say or to actually share on this issue is, number one is, I've seen also, in fact, we're not just talking about like those poor or those B40 groups that are needing their help, especially during this Ramadan, but also we have seen those who are in the M40 groups needing this help. Rightly because some of them are retrenched. When one of them got retrenched, for example, it goes to show that they have reduced the income in the family. Some of them probably when they get reduced the income, probably the wife is not working, for example. So that's one thing. But another thing is that yes, outpouring of help during this Ramadan is just like one-off. Only during Ramadan. I have been to a few PPR during this Ramadan and have seen a lot of like corporate players, especially corporates, who go down to PPR and give out aids. And giving out aids is one thing, but doing like the right thing to give out aids is also another thing, which I have seen sometimes when corporates go down giving out aids, they're just giving, I don't know how to say this, but it's just not appropriate when corporates giving out aids, This is something pretty much very, very concerning or disturbing to me as well, because...
what are they giving? Can you tell us what they're giving?
What do you mean by not appropriate?
From which corporate, but I saw this one lady coming to me when I was delivering our aids from Happy Bank and saying that, we just got this one plastic bag from this one corporate. I asked them actually, what did you actually get? So they were just getting like 2 plastic of biscuits and like a card from the corporate. So I was actually shocked. Like, if you really want to give, especially corporates, you have like the funds, for example, you need to actually ensure that you're giving the right aid for these people, because we're talking about like food aid that they need to live on daily basis. And when we talk about that, food is, we don't want to go really into like how healthy it could be, but that is also important to actually have or deliver quite a balanced diet to especially this poor community as well.
Aini, can I just come back very quickly to something you said earlier about how you wished the ministry was doing more. And I worry about CSOs, civil society organizations, NGOs, not-for-profits like Happy Bank having to do the heavy lifting of the work of the ministry. And I'm wondering where the welfare department is in all this. Is it just that the welfare department is swamped, that they are unable to provide aid to everyone that is in need? Or has the burden fallen on NGOs like Happy Bank to raise funds, to find the people in need and to match those two parts? Do you see government helping NGOs like yourselves, or are you doing the role of government now?
One part of me feels like, they are quite overwhelming, but another part of me thinks that the government is having less of a focus on what actually to focus. Because you see, everybody in Malaysia right now is talking about employment, talking about a lot of issues, especially during this pandemic. But what is most lacking is actually to ensure that livelihoods can actually continue living for the next days or couple of coming days. But I think the heavy lifting that we are taking up right now is also overwhelming. But it's something that I am not sure how to say whether the government is just overwhelming or they're just not doing their job. Because I think I've seen or talked to actually some welfare departments, especially like the JKM, Jabatan Kebajikan Masyarakat, where they are constantly working. But whether they are hitting the right target when working is also important to address.
I mean, very quickly, this must be terribly scarring and traumatic for young kids. Facing the uncertainty of food, we hear that people are being reduced to vegetables. I mean, it could be very healthy, but I mean, watching their parents struggle, how deep will these traumas be for them?
I think it's also important when we talk about children involved in this pandemic, how they are actually involved in this pandemic. We talk about education, we talk about basic food necessity. This is also important to address because I have actually talked to my team earlier on that, when we deliver our aid, we must make sure that we are delivering a balanced diet as well. There's no sugar, there's no, we never provide sugar, actually, to be honest. And this is actually to ensure that, and in fact, we're giving out vegetables to PPRs as well. And this is actually a way for us to educate the people that, it is important to actually start having, not start having, but it's pretty important to actually have balanced diet even at this point of time. But of course, how much can we as Happy Bank itself contribute to actually ensure that everybody gets the right portion?
Right.
But we're just trying our best, of course.
Aini, thank you so much for joining us on the show tonight, and continue the good work that you're doing. Thank you for your service. That's all we have for you on this episode of Consider This. I'm Melisa Idris.
And I'm Sharaad Kuttan, signing off for the evening.
Thank you so much for watching. Good night.
Dan bagi hentikan induk ni adalah Melayu.
Balik kepada Islam. This is
orang yang membuat
action.
polisi.
Kalau itu yang dikehendaki,